Hi everyone, and welcome to the world of clinical histology. Now we will introduce the histology of the respiratory system. The content will be divided into 3 topics. Today's topic will be from the nasal cavity to the larynx. Before starting our topic, we will bring you a relevant clinical case. Hu Qi is an 18-year-old student. When she was 6 years old, her parents discovered that she was allergic to pollen and peanuts and had repeatedly symptoms of allergic rhinitis such as stuffy nose and runny nose. Because the rhinitis did not settle, sinusitis also appeared. During her overseas trip, she accidentally ingested food containing peanuts and developed breathing difficulties. The symptoms became progressively worse. She went to the emergency department and the diagnosis was laryngeal edema caused by allergic reaction. First, let's review the structures and functions of the respiratory system that we have studied in the anatomy course. The respiratory system includes the nasal cavity, pharynx, larynx, bronchus, including the divisions and lung. It is divided into the air-conducting portion and the ventilation portion. The function of the air-conducting portion is remove harmful substances in the inhaled air with humidification and warming. As we can see in the picture, this is the coronal section of maxillofacial region. It shows the vestibular parts, nasal cavity, and olfactory parts of nose. The most important part of the nasal cavity is the turbinate. They reduce airflow and enlarge the surface air for warming the inhaled air. The mucosa is lined with respiratory epithelium, which can play the role of dust removal and humidification. In addition, the top of the nasal cavity is the area where the olfactory bulb is located, so that we can find out whether the inhaled air is harmful through its odor as a self-protection mechanism. Okay. Let's first take a look at the mucosa tissue of the turbinate. This slide is the section of turbinate mucosa. At the top is the respiratory epithelium. We will explain it in detail in the next slide. Beneath the epithelium, there is loose connective tissue, including glands, blood vessels, and immune cells. In our case, the symptoms of runny and stuffy nose were caused by allergic reaction, which increased vascular permeability and glandular secretion. Next, let's move on to the respiratory epithelium. The left is an H&E stand section of respiratory epithelium. We can see the pseudostratified ciliated columnar epithelium. Among them are goblet cells and mucus-secreting glands of the submucosa. This mucus coated the surface of the epithelium to trap dust particles, which are then removed by the cilia. The picture on the right is the scanning electron micrograph of respiratory epithelium. Ciliary cells, goblet cells, and columnar cells are arranged alternatively with a surface layer of mucus. Nasal sinuses open into the nasal cavity. Let's take the maxillary sinus as an example. The mucosa of the sinuses is also covered with respiratory epithelium. There is a thin layer of loose connective tissue containing glands beneath the mucosa. Therefore, in Hu Qi's case, she had untreated allergic rhinitis for some time. This allowed bacteria to go and invade the maxillary sinus. When infection develops, the mucous membrane at the opening swell up and almost close up these narrow outlets. When Hu Qi was 18 years old, she unfortunately took some food containing peanuts, which results in severe allergic reactions and laryngeal edema. As shown on the left, the larynx is very narrow. Histologically, except for the muscles related to the vocal cord, the rest is simple columnar epithelium with lots of loose connective tissue containing glands and blood vessels. In the event of an allergic reaction, vascular permeability and glandular secretion increase, causing mucosal edema similar to the sinus mucosa. The result is blockage of this one and only air passage, so she developed severe breathing difficulty. We can see the swollen larynx through the bronchoscope on the right. In this section, we have introduced the histological features of the nasal cavity, maxillary sinuses, and the larynx. The nasal cavity is lined by pseudo-stratified ciliated columnar epithelium. The mucosa consists of many glands and vessels with lots of surrounding immune cells, allowing this entire conducting portion to react very quickly to the external environment. In the next section, we will continue with Hu Qi's story to illustrate the relationship between the histological structure of the respiratory tract and the typical clinical symptoms. Thank you.